Imagine you have to be hooked up to a machine 3 days a week for 4 hours a day to keep you alive. This is what end-stage renal disease patients must do to prevent death. 1 in 10 adults has some stage of renal failure, as stated by the National Chronic Kidney Disease Fact Sheet of 2010. As a dialysis nurse, I've seen many different patients with all different kinds of renal failure. Renal failure has many causes, which are almost all modifiable to prevent and prolong end-stage renal disease. To understand renal failure, first we must understand the function of the kidneys. The kidneys are a small organ located in the lower back. They have many different functions, but the 2 main functions are to remove waste and remove excess fluid. Other functions of the kidneys include releasing hormones. These hormones are renin, which is used to regulate blood pressure, calcitrol, which is the activated form of vitamin D used to synthesize calcium and prevent bone loss. And then there is erythropoietin, which is used to stimulate red blood cell production in the bone marrow. When the kidneys do not function properly, the whole body is affected, as you can see by the different functions that it has. Now you have to look at the different causes of renal failure. Hypertension is one of the main causes of renal failure. Hypertension causes the blood vessels to go under stress, and this causes the nephron, the working unit of the kidney, to fail. When the nephrons fail, the kidneys no longer work, and when they no longer work, function cannot be regained. This causes buildup of waste and fluid. 1 in 3 adults has hypertension. Diabetes is the #1 cause of renal failure. The increased sugar overworks the nephrons. This also causes nephrons to die. 18.8 million adults are diagnosed with diabetes, and 7 million go undiagnosed. Now, if you can imagine, those that are diagnosed with the diabetes treat it. They take their medication, they go on their diet, and follow a prescription given to them by given to them by a physician. Those that are undiagnosed are not going to be treating this, and it's going to become much more out of control, much quicker, and lead to renal disease faster. Other causes of renal disease are trauma. Blunt force trauma to the kidneys can cause damage to the nephrons and cause them to no longer work, such as a stab wound or some kind of object hitting the back, as in, a car crash or maybe a motorcycle wreck. And then also drug abuse. Toxins can build up in the kidneys whenever you have drug abuse, and this form is also known as acute renal failure. Acute renal failure can possibly be reversed whenever those toxins are removed, but it's unknown until they've been treated for a long period of time. The best way to prevent renal disease is to have regular checkups and screenings for the different causes. As I stated, hypertension and diabetes are the 2 most common causes of renal disease. Both of these can be kept under control, which can also keep the vessels in the kidneys working well. Once damage is done, it is irreversible. So it's very important to catch the damage before it is done. So in conclusion, you now know what the kidneys are and what they do. Their main functions affect the whole body as a unit. We also know what the main causes of kidney disease are and that they're modifiable. Most of you may have or may eventually be diagnosed with one of these causes of renal failure. We also know that regular checkups and screenings can help to prevent these diagnoses from getting out of control and possibly prevent renal disease and end-stage renal disease. Renal failure has many causes which are modifiable and preventable. We need to remember that the kidneys are a small organ, but they do a very large job, and we need to take care of them because once damage is done, it is done, and there's nothing that we can do about it but move on to treatment options, which would include possible kidney transplant, renal dialysis, peritoneal dialysis, or no treatment at all and just accepting death. Now I'm going to introduce you to my audience. We have my husband, my mother-in-law, and my father-in-law. And that is all.